There you see Captain Brett Crozier being cheered by his sailors as he leaves the USS Theodore Roosevelt after being relieved of his command for sending a letter, a warning of the situation on board to his superiors. And we're joined now by one of those superiors, the Defense Secretary, Mark Esper. Mr. Secretary, thank you for joining us this morning.
Thank you, George. Good morning.
You know, we just heard from former Vice President Biden saying the treatment of Captain Crozier is close to criminal, and he was removed from his command before an investigation. Is that appropriate?
Well, George, before I answer your question, let me step back and say a few things about the broader issue we have facing us, and that is the coronavirus. From the beginning, going back to January, DOD has been all in terms of helping the American people and protecting our people with regard to this, and we've been ahead of the curve every step of the way. Second, I've laid out 3 priorities for our commanders for all of DOD. First, protect our people. Second, ensure we retain our national mission capabilities. And then number 3, provide full support to President Trump's whole nation, whole government response. And so the last point I'd like to say is I'm very proud of the 50,000 plus Americans in the military who are out on the streets of America today helping their fellow Americans. Many of our service members are deployed from home. Many are risking their own well-being to help their fellow Americans. I'm very proud of them. With regard to your question about the captain, the Teddy Roosevelt, look, Secretary Mobley made a tough decision, a tough call. I have full faith and confidence in him and the Navy leadership, and I supported their decision.
And the president said you were involved in that decision as well. David Ignatius is reporting this morning that Secretary Mobley said the president wanted Captain Crozier fired. Is that true?
Look, this was Secretary Mobley's call. He came and briefed me the night before, the morning of. He sat down and talked to me. I listened to the recommendations of the CNO, the Chief of Naval Operations, and General Milley, the Chairman of the Joint Chiefs of Staff. It was Secretary Mobley's call, and I told him I would support it.
Did the military leaders agree with Secretary Mobley?
I'm not going to comment on our private conversations. You can talk to them separately. This is a chain of command issue. It's an issue of trust and confidence in the captain of the ship.
So what happens to the captain now?
Well, George, I can't talk too much about it, and because I'm in the chain of command, there is also an investigation ongoing, and it may fall on my desk at some point in time. What I'd really like to do is talk about this global pandemic facing the country, maybe the greatest since 1918, and tell you about how DOD is really weighing in and helping the American people.
I do want to ask about that, and I know that the president said yesterday that 1,000 medical personnel have been sent to New York. What exactly are they going to be doing, and is the Pentagon now prepared to allow COVID-19, patients suffering from COVID-19 to be treated on the USS Comfort in New York?
Sure. Well, first of all, we have well over 1,000 medical professionals deployed around the country, principally in New York, Seattle, New Orleans, Dallas, and elsewhere. In New York alone, we have over 1,000. We will be sending up over 1,000 medical professionals today, tomorrow, and the next day. In a late change as of yesterday, we decided a few hundred of those would be deployed in New York City hospitals to augment the hospitals there. And so what you're going to find is the Javits Center will become a 2,500-bed hospital. It will be the largest hospital in the United States, and it will be run by the United States military. So we're all in on this, ahead of need with regard to that. And as you asked, with regard to the Comfort and the Mercy, we sent those ships up several days, a week ago. They also arrived ahead of need. We're prepared to open them up to COVID-19 patients as necessary. I've already delegated that authority to the NORTHCOM commander, who's responsible for the operations in the United States. We've been keeping those in reserve, if you will, because we know this will move around the country, this virus. And these ships are a large 1,000-bed medical capacity that is deployable, that is mobile. And we want to make sure we can continue to deploy them as necessary. But if the virus gets so bad in New York City or LA we need to, we'll certainly be prepared to open them up to coronavirus patients. We just don't want trauma patients to become coronavirus patients too.
Yeah, that's a real concern. And have you sent out all the respirators you have access to?
Yeah, we offered up weeks ago up to 2,000 respirators. Many of those are deployed with our hospital ships. They are deployed with the field hospitals we've sent to New York, Seattle, and elsewhere. We have pre-positioned several hundred outside of New York, and we have others that we're prepared to ship wherever told to ship them.
You said at the top of this interview that the Pentagon has been ahead of the curve every day, and you mentioned January, but did the Pentagon receive an intelligence assessment on COVID in China last November from the National Center for Medical Intelligence of DIA?
Oh, I can't recall, George, but we have many people that watch this closely. We have the premier infectious disease research institute in America within the United States Army. So our people who work these issues directly watch this all the time. As you know, the first patient in the United States was discovered in late January. We activated our global pandemic response plans on 1 February. I issued guidance to the force for force protection on 3 February. And we didn't see our first casualty in the United States, and God rest their soul, until 29 February. So you can see we were weeks ahead of this in terms of preparing our own force and opening up our stockpile to the rest of the government.
But that's in January, because reportedly this assessment was done in November, and it was briefed to the NSC in early December to assess the impact on military readiness, which of course would make it important to you, and the possible spread in the United States. So you would have known if this were briefed to the National Security Council in December, wouldn't you?
Yeah, I'm not aware of that. I will tell you again, our folks work this all the time. That's why we have a global pandemic response plan that I initiated on February 1st. That's why we have stockpiles of strategic supplies, whether it's masks, gowns, PPE, ventilators, all those things we need. We got to be prepared for any type of contingency or any type of warfighting environment that we may be operating in. That's why we've been poised and ready to support the whole of government effort.
And the real question now, Sid, one of the things you're most focused on right now, the impact of COVID-19 on the readiness of the U.S. military right now. Some 1,200 service members have been infected. I assume that number could go up, and now you have one of your aircraft carriers out in Guam. How concerned are you about its impact on readiness? Well,
we watch it very closely, but you're right. We don't have large numbers right now reporting being infected by the virus. Of those that are, only 35, thank goodness, are hospitalized. None of our active component members have died. But out of a force of 2 million, we're in pretty good shape right now. But we've taken extensive measures. I've issued 4 sets of guidance now, going back to 3 February, with regard to how to protect our force. We've done a lot of social media. I've done town halls with our forces, just to make sure we're taking very good care of our service members, of our civilians, and their families. And do you expect all those service members and civilians now to follow the CDC guidance calling for the wearing of face coverings and masks in public? And will you? We will have a directive coming out on that today. Again, we want to take every measure to protect our troops. You know, I said priority 2, George, is making sure we can conduct our national security missions. And to do that, we can't always do 6 feet distancing, whether you're in an attack submarine, a bomber, in a tank. So we have to take other measures. And I trust the commanders and our senior NCOs to do that. But we want to provide them all the guidance they need to adjust it in whatever is unique to their situation, their circumstance, or their mission set. But we should expect more widespread use of masks then inside the Pentagon and with service members? No, we are going to move toward face coverings. Secretary Esper, thanks for your time this morning. Thank you, George.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.